Hello, everyone, and welcome to the latest knowledge sharing event for the Rural Violent Crime Reduction Initiative, or RVCRI. My name is John Conley, Senior Program Officer with the Safety and Justice team at LISC. Joining me today as part of the RVCRI team is Juliana Palmer, Policy Advisor with the Bureau of Justice Assistance, which provides funding support to and leadership for the RVCRI program. Also joining me today is Samantha Reinierson, Senior Program Manager with MPI, our fellow TTA provider for the RVCRI program. Today's topic will focus on the introduction of the Community-Based Violence Intervention and Prevention Initiative, or CVIPI, as I like to call it, followed by a discussion of rural opportunities around this work. And I'm going to get to our exciting agenda in just a moment, but first want to cover just a few housekeeping items. So I want to make sure that we acknowledge that this project is supported by a grant awarded by the Bureau of Justice Assistance, Office of Justice Programs at the United States Department of Justice. The opinions, findings, and conclusions or recommendations expressed in this program are those of the authors and do not necessarily reflect those of the Department of Justice. Just a few event logistic notes. This event is being recorded and we will get it posted to the RVCRI resource page as soon as possible, along with a copy of this deck presentation. Toward the end of the event, I will put in the chat an event survey link. We know that folks are asked to complete surveys quite often, but please believe me when the RVCRI team takes your critical feedback into account to help and inform and improve future RVCRI offerings. So thank you for taking the time to complete that survey. And we are going to try to end this event with an opportunity for questions and answers, but do also encourage folks to either utilize the Q&A button or the chat feature to enter in comments and questions that you would like posed to the presenters. So let's get to the exciting agenda. So again, as noted, we're going to hear from my colleague, Ryan Samuelson, in just a moment around an introduction to what CVIPI is and a quick review of the 2024 national convening of grantees. After that, we're going to hear from Dr. Paul Smolkowski and his colleague, Leon Burton, around what CVIPI can look like in a rural setting. Again, we're going to try to leave time for questions and answers. And then we'll have a few moments for announcements. So with that, it's now my great pleasure to introduce our first presenter, Ryan Samuelson, my colleague, Senior Program Officer with LISC. Ryan recently joined LISC after 4 years with the International Associations of Chiefs of Police, or IACP, where he was responsible for managing over $10 million worth of US DOJ training and technical assistance grant funding. Holds a Master's of Science from Arizona State University and a Bachelor of Arts in English from Drake University. Just a personal note, I met Ryan while he was supporting a series of community safety projects in the Kansas City, Missouri region. At that time, Ryan was an instructor for the Department of Criminal Justice and Criminology at the University of Missouri, Kansas City, while also serving as a consultant for the Kansas City No Violence Alliance, or NOVA, the Jackson County, Missouri Prosecutor's Office, and the Kansas City, Missouri Police Department on a series of US DOJ grant initiatives, including the Burn Criminal Justice Innovation, or BCJI project, Innovation Prosecution Strategies, and Smart Policing Initiative grant opportunities. In short, Ryan brings to us a wealth of experience and subject matter expertise to the safety and justice team. We're incredibly thankful for his significant contributions to our work already. Ryan, welcome to your first RVCRI event, and I'll turn it over to you, sir.
Thank you, John. And I like that, CVIPI. I don't think I've heard that before. It's got a good ring. Well, hello all. As John said, I'm Ryan Samuelson, a Senior Program Officer for the LISC Safety and Justice team. And I'm honored to join you all today to share some of the innovative work happening in the community violence intervention and prevention space. You can go to our first slide, John. So let's start by establishing some common foundation. So I'll be providing some brief remarks to help describe the Federal Violence Intervention and Prevention Initiative, CVIPI, in Community Violence Intervention, CVI, and help describe some of the essential elements and guiding principles of this impactful work. I will also take some time to share some foundational resources and share some highlights from the recent CVIPI conference. Let's start with some basic problem definition. When we refer to community violence, we're describing acts that happen outside of the home, in public spaces. Most often, community violence involves only a relatively small number of people as victims or perpetrators, but it affects entire communities. Recurring incidents of violence lead to trauma and negatively impact the health and well-being of the community, even those residents who are not direct victims of violence. Violent activity also creates economic disruptions for businesses and employees in the surrounding area and can severely impact community perceptions of safety. The term community violence intervention, CVI, refers to a set of community-centered responses to community violence. CVI uses evidence-informed, multidisciplinary, and community-centered strategies to engage with individuals and groups most at risk of perpetrating in or being impacted by violence. The purpose of CVI is to prevent and disrupt cycles of violence and retaliation and establish relationships with individuals and community assets to deliver services that save lives, address trauma, provide opportunity, and improve the physical, social, and economic conditions that drive violence. Mitigation efforts typically focus on identifying and intervening with individuals who are most at risk of being involved in violence as the instigator and/or the victim, and they also address the underlying historical and structural challenges that often result in community violence. Next slide, please. CVI strategies are built around some common essential elements. For example, CVI centers community members as full partners and leverages trusted, credible messengers to deliver key intervention elements. CVI approaches include representatives of the affected communities as full partners who provide input and guidance on the intervention's approach and focuses on those individuals at highest risk of experiencing or perpetrating community violence in the near term. CVI strategies utilize data from multiple sources that is vetted for racial, ethnic, economic, or biases to inform the approach. CVI employs practices that are informed by and respond to the impact of trauma on individuals and the broader population in historically underinvested communities, and leverages public, private, and community stakeholders most impacted by violence in building authentic relationships to prevent violence, strengthen community resilience, and build social capital. And CVI approaches rely on cross-sector stakeholders with authentic relationships to advance racial, ethnic, and socioeconomic equity, including the understanding that many social, demographic, economic, and institutional factors perpetuate community violence and bring supportive responses directly to the neighborhoods and people with the greatest need. CVI strategies are place-based and person-centered interventions directed at root causes of violence. They provide an alternative to violence reduction approaches that have traditionally focused on arrest and incarceration. Next slide, please. Some guiding principles. CVI is community-centered. CVI approaches must be informed by and tailored to community residents and stakeholders. Everyone involved in the effort must prioritize the needs of the community. This means social service partners are engaged to align and collaborate with residents and law enforcement partners to reduce violence and build community. CVI is equitable and inclusive. Care must be taken to guarantee the community members most affected and most disenfranchised are included in creating CVI solutions and benefiting from them. CVI is evidence-informed. CVI approaches should be built using evidence generated by multiple disciplines and a variety of methods. Evidence used to support CVI programs may include findings from research and evaluation, as well as case studies, expert opinions, or documented lessons learned from the field. Ideally, CVI programs engage in research and evaluation to help build the evidence base for what works. CVI is effective and sustainable. CVI approaches must demonstrate measurable impacts on violence and community well-being and must receive access to resources that support responses to new and ongoing challenges over time. Next slide, please. Speaking of resources, the National CVIPI Resource and Field Support Center was established to serve the wider field, inclusive of organizations who do not currently receive federal CVI funding. The U.S. Department of Justice, Office of Justice Programs, Bureau of Justice Assistance supports LISC and other training and technical assistance partners to bring critical CVI resources to local governments, community practitioners, and their partners as they work together to prevent violence. The National CVIPI Center website serves as a central repository for information about community violence and effective strategies to address it, as well as training opportunities and connections with peers or experts who can help identify responses that worked in their communities. Feel free to scan these QR codes or click the link in the chat to learn more about the National CVIPI Resource and Field Support Center, request training and technical assistance, or join the community of practice. CVI strategies can take different forms based on the needs and opportunities within a community. While community voices and relevant data should guide the development of a locality's CVI strategy, all CVI models seek to reduce violence through means other than arrest or incarceration, engaging those at highest risk of violence in holistic, coordinated interventions designed to help them achieve wellness, healing, and long-term success. Common elements of a comprehensive community safety strategy include violence interruption strategies, often called street outreach, that seek to stop imminent incidences of violence by mediating conflicts and encouraging peaceful ways to resolve disputes. This strategy uses trained violence interrupters, trusted credible messengers with the professional expertise and personal connections to intervene when violence is occurring or imminent, or in the immediate aftermath of an incident to prevent retaliatory violence. Another strategy is hospital-based violence intervention. These programs are a form of violence interruption that leverages partnerships with trauma centers or emergency rooms to identify and engage individuals admitted with violent injuries who are at risk of repeat victimization. These programs aim to interrupt the cycle of violence and retaliation by providing trauma-informed care, services, and safety planning to victims of violence and to their friends and families in a hospital setting, as well as connections to long-term resources within the community. Group-based violence intervention. The majority of community violence is caused by a small number of people. Group-based violence intervention focuses on communicating directly with those people most at risk of becoming involved in violence, providing intensive services, connections to opportunity, and as a last resort, narrowly focused enforcement. And lastly, prevention strategies, which can be an important complement to violence intervention as part of a holistic approach to addressing community violence. Common prevention strategies include crime prevention through environmental design, known as CVIPI, which considers how the design of the physical environment, including buildings or spaces in the community, can minimize opportunities for crime to occur in specific places. Next slide, please. Many of these strategies were resplendently highlighted at the 2024 CVIPI Grantee Conference, April 3rd through the 5th in Chicago, Illinois. The conference was an opportunity for CVIPI grantees to work with Office of Justice Programs grant managers, subject matter experts, training and technical assistance providers, and other community violence intervention grantees, while learning and sharing best practices and strategies for implementing violence intervention and prevention activities. Some sessions from the conference were live streamed and recorded and will be shared on the National CVIPI Center website to share in-depth approaches to CVI in communities across the country and offer insights into implementing CVI strategies. Click the link in the chat to learn more about 2024 CVIPI Grantee Conference, including the agenda, plenary and breakout workshop resources, and exhibitor resources. Next slide, please. As you can see on the graphic, we had 757 registrants, of which 652 formally checked in at the registration table, which we're counting as attendees, representing 40 US states and territories and over 330 organizations. Next slide. In the final conference evaluation, participants were asked to rate their agreement or disagreement with 14 statements about the conference. Each question tied to a learning outcome was on a scale of 1 to 5, where 1 was strongly disagree and 5 was strongly agree. The average rating across these 14 measures was 4.35, somewhere between agree and strongly agree, and the average percentage of respondents who agreed or strongly agreed was 88%. Participants were also asked to provide feedback about the most helpful parts of the conference. Common themes included participants expressing appreciation for networking, not only as a resource for learning relevant tools and strategies from others, but also as a means of building relationships for future collaboration and support. Participants also appreciated data-related content, ranging from data collection and analysis to discussions of the importance of data and research in the CVI field. And participants valued hearing directly from practitioners and people who have been impacted by community violence. Participants were also asked to identify 3 steps they will take as a result of participating in the conference. Some common ideas shared by participants included sharing information with colleagues and communities, implementing best practices, networking and collaborating with other participants, grantees, and organizations, building relationships with community partners, and collecting, analyzing, and using data. Those are the themes that rose to the top. Our next presenter, who was also a resplendent presence at our conference, will be introduced by John shortly. Thank you all for your time. I'm looking forward to questions.
Thanks so much, Ryan. Really appreciate that great foundational and introductory conversation on what CVIPI is. And so now we'd like to turn to our next speaker, who will talk about how CVIPI can play out in a rural setting. So it's my pleasure to now introduce Dr. Paul Smolkowski. His team currently partners and supports multiple rural police departments in the state of North Carolina on their respective RVCRI projects. And as Ryan noted, Dr. Smolkowski's presentation follows a rural-based session opportunity that he and I participated in during the recent Chicago CVI National convening in April that Ryan just shared as we were prepping for this event. Was quite highly rated. So hopefully you'll agree it's a great opportunity to learn more about CVIPI and work in a rural setting. So Dr. Smolkowski is the executive director of the North Carolina Youth Violence Prevention Center, has an interdisciplinary background in social welfare, criminology, child development, and public health. He has served as a full professor at the University of North Carolina, Chapel Hill, Arizona State University, and the University of Kansas. His research teams have secured more than $20 million worth of federal funding to design, implement, and evaluate community-based prevention initiatives. As an author, he has published more than 120 articles, book chapters, and books on issues related to adverse child experiences, bullying, risk, resilience, adolescence, mental health, family stress, and youth violence prevention. As such, we're extremely grateful to Dr. Smolkowski for sharing his time and expertise with us today. Paul, I'll turn the presentation over to you and also allow you to introduce your colleague, Leon. The floor is yours.
Great. Thank you very much, John. And we will endeavor to be as resplendent today as it was in Chicago. And now I'll try and build on Ryan's presentation. Thank you very much. I'm Paul Smolkowski, Executive Director of North Carolina Youth Violence Prevention Center. And I want to introduce my colleague, Leon Burton. Leon. Hey. Leon is one of our lead violence interrupters on our project, and he'll tell you a little bit about his on the front lines work. So we'll jump right in. Next slide, John. Thank you. So this is my information in case you'd like to contact me for any further discussions about what I'm about to talk about today. I'm a big advocate for CVI in rural areas. I also do want to express our gratitude to BJA. We started our work about 12 years ago in Robson County, North Carolina, through a CDC grant for a Youth Violence Prevention Center. And then that moved into a BCJI grant, which moved into a CBCR grant, and then now the CVIPI. So we've had a lot of acronyms. However, the work has remained the same, which is prevention and intervention for violent and other types of crimes. Next slide, John. Thank you. Just a shout out to members of my team. This is actually was in St. Louis at the previous conference. We have both violence interrupters, and the two gentlemen in the back, Mike Brill and Leon Burden, are our lead violence interrupters, our credible messengers to the community. And then in the center there, Martika Bacayao is our head of victim services. We do that in-house so that we help both victims and increasingly offenders, also those who are at highest risk. I'll tell you about that as we go along. Next slide. Thank you. Okay, perfect. So I'd like to start with this slide because we are in Robson County, North Carolina. Many of you may not have ever heard about it. We're near Fayetteville. Fort Bragg area is about, half an hour away. However, our main metropolitan area, which has about 20,000 people, is Lumberton, North Carolina. And if you actually did the crime statistics by per 1,000 residents, which usually isn't done, it's usually on the list that you see are per 100,000, which really doesn't give a fair shake to rural areas. This is calculated per 1,000, and you can see on the list on the left-hand side, Lumberton would be number 7 at the time. It now has gone to number 5. And what I want to point out here is look at how many of them reflect what you would consider to be densely populated urban areas versus rural areas. I mean, certainly Saginaw, Michigan, and Monroe, Louisiana are not that at the tip of your tongue when you're thinking about violence prevention. You might be thinking Baltimore, Chicago, New York City, maybe LA, and those areas certainly are worthy of attention. However, I'm an advocate for rural areas because they often lag far behind in terms of resources and attention for this kind of issue. And you can see on the chart there, this is Lumberton over the last 20 years. And you can see the crime and violence is a very long-standing problem, and it's much higher, about 6 to 7 times higher than either North Carolina as a state or the US. Next slide, John. Thank you. So here's some more data, and this even drills down further. Our latest grant integrates 4 smaller town police departments. They're right there, Fairmont and Pembroke and Red Springs and Rowland, North Carolina. If any folks on have joined us from those areas, thanks for doing that. Sometimes in these police departments, you may be responding to emergencies and not be able to grab a webinar like this. So thanks for joining. Anyway, what I want to show you is look at the homicide rate per 1,000, okay? If you look at Pembroke, North Carolina, let's just shout out there. It's about 10 times the homicide rate of the United States. So these are the types of things that I try and highlight in terms of risk. Now we are talking about 2,800 people versus 329 million. However, even though the base rates are much lower, the impact of just a handful, I think maybe about a dozen homicides in a small town like that has a dramatic impact on the residents' psychological functioning. Next slide. Thank you. Okay, so we do have some unique risk factors in rural areas that I just want to highlight. Probably the most dominant one that we talk about is isolation. Now, this can be in terms of the Sorry about that. Someone isn't muted. Isolation can be one of our strongest risk factors, and that because there's often fewer community resources, and isolation can really feed into depression, anxiety, drug use, alcohol use, and those problems then kind of fold into violence and crime. So rural areas often have fewer providers, mental health providers, as well as primary care physicians. Also, dentists are really rare in our area, for example. So you do tend to get higher rates of unintentional injuries, traffic fatalities, also physical problems like heart disease, cancer, smoking, obesity. So all of these things make a bit of a package that are interrelated risk factors within our community. Next slide. So there are challenges, and I want to frame this discussion in terms of unique issues that you might come to the fore in working in a rural area. So our county that we're trying to do our efforts with is 954 square miles. So when I talk to some of our colleagues who are doing this in Chicago, for example, they might have a neighborhood of 3 blocks or a census tract. And so they can really patrol that neighborhood several times a day. But Leon's work driving around 900 square miles, you really have a very different nuance in terms of how you have to approach the work in the rural area. So distance and geography is one really serious risk factor that we grapple with. There's also in the small towns that I just showed you the data from, you can also have trust issues or insider-outsider dichotomy. And what I mean by that is many people have lived here for generations. And for example, when I came to this work, I was an outsider from the university, and it probably has taken me, well, maybe I'm still not. I still am an outsider and will continue to be, but it's gotten better over the last 12 years, I'd say. So one thing is building trust and building a team. And this is what I've done, build a team with folks like Leon who have been here and really both understand the social networks and the risk factors in this community. So they're very much ambassadors to working with both the key leaders as well as community members, all types of stakeholders. Sometimes there's just plain old infrastructure issues that can be poor cell phone coverage. We provide mental health services for free through grants to many different kinds of families. And often in the rural areas, they don't have as much internet coverage. They may not even have have Wi-Fi. And so we try to expand our services through telehealth and Zoom, for example. However, it is a challenge, especially for certain populations like the Latino community in our area. They often lack cell phone coverage, for example. Now, once you're accepted into with trust to the community, then you can make these efforts much quicker. You can launch much faster. And that's where I want to bridge to positive factors in the rural community. You actually have a dense social networks where people know each other. And if you can positively activate those social networks, then you can get 80 families in a room together in a week, or you can get a grant proposal where all of the major leaders in the city are signed on to one theme, because you can bring people together without as much, I think, bureaucracy as in a dense urban area. Next slide. So I think I talked about challenges in terms of police work. Sometimes our rural agencies struggle with recruiting officers. and because they might be able to get a higher salary or a different type of position in our major cities like Raleigh or Charlotte. So it's difficult to recruit, and it's very competitive to get those applicants. So because resources are thin, you can train folks, but then once they might move on to larger urban areas where the pay might be better, for example. Next slide. However, like I mentioned, there are strengths that I just want to highlight. Many officers in rural areas become generalists. In social work, you'd call them generalists, which means they do a lot of things well because they have to. So sometimes I'll go into a rural police department and say, well, where's your juvenile officer? Oh, that's Sandy. Oh, where's your gang officer? That's Sandy. Okay. Where's, and so you get my point. They have to, because of capacity, they have to become very skilled in using the resources that they have and cutting through bureaucracy as much as possible. So that is definitely a strength that we've seen in working with now 6 different police agencies. Okay. They have to be flexible, and you have to maximize the resources that you do have, because often it is thin. One thing that we do with our crime prevention grants is we help them with certain things, like surveillance cameras was a big piece in our LISC grants, or help with training the K-9 unit. Some things like that, they just don't have the funds to pay for, and we've brought that to the table, as well as overtime for their officers to do special operations. Next slide. Great. So I'm not going to go over this very much because Ryan did a great job of doing that. So hospital-based, group-based, and some of these, I think as an agency, our experience has been starting with pieces and then building and building and building. Right. And so now Leon comes and tells me last week, oh, the hospital wants to meet with us. And so as we have community meetings, we build different pieces onto a framework so we can have comprehensive services. And then the violence interrupters that we've built over the last 2 years or so, they really go into the community, build relationships, and they're really on the front lines of mediating conflicts. And so with that, I'm going to pause. I'm going to give Leon now Leon's a minister, so I'm going to have to ask him for about 2 minutes, just 2 minutes, okay? And let's hear from Leon with his violence interrupter work.
Yes, thank you, sir. A lot of times we go out in the community, we hear about crimes getting ready to happen. We go out and talk to the kids that gonna commit the crimes. We sit down, talk to them, try to get them back on the right track. We also work inside the courts on Tuesdays, trying to get these kids back into the community. First time we had the chance to work with a high-risk kid that have a lot of shooting in their background. A couple months ago, we had some shooting going on at our high school, and we went to court one day, and the chief district court judge asked us, would we work with some of these kids? And we started working with some of the kids. As we started working with them, I started listening to the kids talk, and I know that they did an intake on them with juvenile services. But I listened and I asked the chief court judge, I said, where is their mental evaluation at? Because one should be done on each child, especially if he's doing shooting around a school. It's something going on somewhere. And we end up getting that piece through us doing, so we can get our evaluation on each child At the time we were doing all this, we had 32 kids that is from the court system, and we end up getting 6 of them enrolled back in school. One parent got enrolled back in school. We end up getting 4 of them a place to go out and go to work, getting them a job. So we do so many different things when it comes to the violent interrupted work that we do here in the county. If we get a phone call at 4 o'clock in the morning and it's involved with a kid, all the officers know that we're gonna come out. They know we're gonna come, we're gonna go see what we need to be done. We go to houses and talk to the kid. If we can't help the kid, we'll try to find programs that we can collaborate with to make sure the kid get all the necessary tools they need to keep them in school, keep them out of trouble, and keeping them on a positive level.
Thank you. Great. Good. So let's go to the next slide, and Leon and I will kind of back and forth. So this is what we've built over time in our center. It's a 3-tier model, really. And so the very bottom of that pyramid in green is our community awareness. So we do youth mental health first aid, community resilience model training that gives a sense of trauma and a basic understanding of trauma for community stakeholders. We do parenting wisely, gang prevention, that's Leon's work in the schools, bullying prevention with interactive theater. So we do a lot of awareness activities. Then we try and engage youth through positive group activities. So we use the expressive arts for engagement a lot. So we'll bring together youth to paint. We paint parties, we call them. Again, the interactive theater. And we're out in the community trying to engage families and then groups of youth. Once they become more warmed up to us, where they trust us, then they'll start to talk, right? And then we can try and hook them in further to services that they might need. And that leads to the highest level, where you see our trauma-focused therapy in particular, and where our association with the courts that Leon's just said, where we're trying to do a trauma-focused assessments in our district court so that they're more aware of the background that the kids bring.
Yeah. And one thing I do say about the work we do, we have to be honest with the kids. If you tell them you're gonna try to help them, you got to be there to help them. You got to know what not to say and what to say, because sometimes it's a trust thing. Once you build that trust level with them, you got to stay there with them, because once they see that you betray them, they lose all trust, not only in you, but most likely the whole agency. Everything fall back. Like they don't want to talk to you no more. They want to push away from you. So it's great to always be straight up with them. If I can do it, I'm gonna do it. If I can't, I can't. But I'm gonna try to find you the help that you need. But make sure that I learned over the years of the last 18 years that one phone call at 1 o'clock in the morning can help them save their life, so they don't end up trying to kill someone or hurt someone in some kind of way.
Thank you. Yep. Next slide. Oh, okay. So this is an example of our paint parties. I mean, kids do come together. They paint using a therapeutic theme. So, for example, we just had 80 parents and youth come together for Mother's Day, and they painted a memory of mom. They leave with a painting, so a creative activity, but they've also talked with their family members and bonded with us and with other families in the community. So it's really a social support as well. And we use interactive theater for conflict resolution in the schools. We'll act out scenarios, for example, bullying, so that then they can handle, how do you resolve this problem without fighting? You know, what are other alternatives? Next slide. Great, and this is a picture of us. We were highlighted in for our NPR station in North Carolina. So we have a lot of impromptu meetings like this where we're trying to get up to speed on who's doing what where. And so this is our violence interrupter work. There sometimes it's often trying to prevent the next problem or having a problem not escalate into violence.
Yeah, because we just had a situation down in Fairmount, North Carolina, where they had some shooting going on down there Sunday. And we end up going down there Monday to look to see what was going on and talk to some people and stuff like that, you know, but they did end up catching the guys that did the shooting and everything. So, you know, I take my hat off to Fairmount Police Department for that.
Yep, absolutely. And from the LISC grant that they had in Fairmont, that they put they used some of that funding to put cameras up for surveillance, and that has helped with finding, you know, offenders. There was a shooting at a McDonald's recently where they were able to pull the footage and get right to finding the suspects. Next slide. Okay, so again, well, this is some work that Leon does around the county, which is trying to identify gang signs, this in graffiti, and they're all over the place. And then we have an agreement with the town to help tell business owners that they need to paint over these quickly, or else within a week or so, I believe that,
7 days.
yeah, 7 days, the gang will come in and it's their territory at that point. So we try and respond to this as a community need, and beautification, of course, you know, trying to keep things looking nice.
I'm thinking that mailbox is at the mall.
Right, yeah, the mailbox is at our mall, so it's tagged. Okay, thank you. Next slide. Great. So some of the things we've helped and provide assistance with our police departments, identifying hotspots and doing hotspot policing, so problem-oriented policing. So this can be from the past research that is helpful with reducing violent crimes, traffic accidents, DUI. So, and then we also have, with the problem-oriented policing, it can help identify how can we assist those repeat offenders? They're coming through the court again. What can we do to try and set up what we call a remediation plan or a rehabilitation plan, where our services might come in and be able to divert them? Again, many of the kids coming through juvenile services that we see, about 90% of them are coming out very high on our trauma assessments. So we connect them to mental health services if they're willing. Okay, so what we've learned is that credible messengers can be quite useful in working within the social networks in the community. Again, Leon has been here his whole life working within the community, and no one in our community knows the gang systems better than Leon does. So that helps with, in fact, I was going to joke in our first picture of Leon, he often is scowling because he needs his credible messenger. He can't smile or else he'll lose some of his street credibility. But he is a lovely, happy man.
Oh, yes, yes, I am.
Okay. We do a lot of that positive youth development activities because our youth basically will tell us there is nothing to do. So we try and structure this art and drama, you know, and activities, sometimes field trips, and we're doing more and more of that to give them an alternative that's stimulating instead of their having extra time to get into trouble. Exactly. Summer camp that we're getting ready for. Again, Leon's done it for years, and we do that for kids who have experienced adverse experiences. Okay, let's go to the next slide. I know our time is short. Okay, this is our last slide, I believe. And let me just, for those of you who like data, this gives you a long-term perspective, but here's some progress in our crime reduction. So from 2010 to 2021, these are uniform crime reports and per 1,000 residents. So you can see from our sheriff's office, that goes for the entire county, 954 square miles. You can see that there's been about a 48% decrease in property crimes over the last 11 years that I'm showing you. If we switch to violent crime, you can see the third one down, Pembroke, has decreased about 80% in its violent crime from 2010 to 2021. Now, we're working on a current grant, and the crime, to be honest, it's hard because it bounces up and down, especially in a small area where another murder or two makes a huge difference in the numbers, right? So I'm showing you some decreases here that we're proud of, but it is an ongoing, challenge that we continually are working on.
Every day.
And you can see, compared to North Carolina, which is near the bottom, and the United States, though the increases that we've been able to help with are much larger, 3%, for example, for the USA in violent crime during that time versus 40 some percent. So we are proud of what we've been able to do in this area, but there is certainly more work to be done.
Plenty more work.
Mm-hmm. Okay, John, can you go one more? Yeah, I thought so. So I'm going to hand it back to you, and any questions that you want.
Thank you so much, Paul and Leon. Great presentation. And also thanks to Ryan again for his presentation. I don't see any questions in the chat thus far. So I also welcome my fellow panelists, Sam and Juliana. If you'd like to provide any additional comments at this time, welcome that. And I do now see impressive comment from Chris. Thank you for that. And Micah, thank you for those comments. Continue to think about those questions, throw those in the chat. I'll go to our final two slides, and then if we have time left, we'll continue to take your questions. So what's next? Just a few comments here. I'm about to put that aforementioned survey link in the chat. Encourage folks to click on that and open that up in another browser window before you go today, and make sure to complete that if you would before you leave today or shortly after you leave today. And also want to now invite my colleague Sam from MPI to briefly talk about some upcoming events for the RVCRI program. Sam?
Awesome. Thanks, John. So I'll make my comments brief. Two events that are forthcoming for RVCRI. One is our next Rural Roundtable event is going to be scheduled for June 20th at 2 p.m. Eastern time. So you all will be receiving information this week or early next week with the invite for that one. The roundtable is going to focus on evidence management and retention. So we'll be talking about both like physical evidence management and retention as well as digital evidence. And then the next NPI-led webinar for RVCRI is going to be on July 18th at 2 p.m. That one's going to focus on crime analysis and intelligence analysis and how rural agencies are using that data, as well as some additional resources that are available for folks to access. So those are just two events that'll be coming up soon. So with that, John, I'll turn it back to you.
Thanks so much, Sam. And I do see a question that's popped up, and I believe this is for you, Paul and Leon. This is from Kathleen Weber, who is from a peer RVCRI site in Kewanee, Illinois. She asked, are all of the directed policing, community awareness, and art activities all grant funded, meaning through your RVCRI grant, or through other partnerships, if you want to take that question?
Yeah, absolutely. Good question. So they are all grant funded, yes, but we've been able to do some braided funding for sustainability. So let me say that just briefly. We have two major sources. One is BJA for our crime reduction efforts, but we have gotten funding recently from SAMHSA and for childhood traumatic stress, and for it's called the Recast Initiative, resilience in communities after stress and trauma. And the trauma in our community is violence. So what I want to mention is it is all grant funded, but we've had to be entrepreneurial in funding different pieces of this in different ways from funding sources that are all focused on these issues.
Great, thanks, Paul. Really appreciate that. I don't see any additional questions here at the moment, so I will go to our last slide. Again, the recording of this event will be made available and posted online as soon as possible, along with a copy of this deck. So you will have access to all of the hyperlinks that you see here on the final slide. The first three, the Field Resource Center, is the link that Ryan shared in the chat, as well as the QR code earlier in his presentation. Ditto for the LISC CVIPI TTA request and the Community of Practice. For those that are interested, really hope that you utilize those resources. You'll also see the CVIPI program overview. This is a really great web-based resource made available through BJA and the Office of Justice Programs. I want to highlight this link because it does provide information on previous and current funding available through the CVIPI program. There is a site-based award available now for fiscal year 24, though, however, it does unfortunately close early next month. But I'm flagging this for what I would believe would be a number of RVCRI grantees who may consider this funding opportunity should fiscal year 25 funding for the program likely available around this time next year. Should that funding become available, would strongly consider RVCRI teams to take a look at that as a potential sustainability opportunity or an opportunity to begin to build some of the foundational pieces that Dr. Smolkowski and Leon have been talking about here today. The next link is a North Carolina CVI program overview from the local PBS station. Made rock stars out of Paul and his team. So encourage you to take a look at that. And then lastly, there's a link from a Practices in Modern Policing video put together by our friends at IACP, Policing in Small, Rural, and Tribal Communities video that Paul and I thought really helped emphasize some of the themes that were discussed here today around partnership. And with that, I see we have a few minutes left, but I don't see any further questions in the chat or the Q&A. So I will just close this event by saying thanks once more to Dr. Smolkowski. Thank you, Leon. Appreciate it. Thank you to Ryan, my colleague, for his presentation. And last call for Samantha or Juliana on any final parting comments.
No comment from me, John, just echoing your thanks to everyone for today's fantastic webinar.
Great, thank you. Wait, Caitlin says, wait, any advice for someone doing this work in the community? So Caitlin, I think some of the links that have been provided by Ryan, particularly the implementation checklist, is a really great tool for if you're looking to get started, if you haven't started yet and you're thinking about developing CVI programming in your jurisdiction. I think that's a great tool. You love that tool. I was already looking at it. Great. And so I'd say that along with the overall Field Resource Center would be great opportunities to begin kind of your adventure around this type of work, Caitlin. And of course, our team would be happy to follow up and have additional conversations with you. And thank you, Chief Hunt, for attending that final comment. Chief Hunt is Chief of Pembroke, North Carolina, and partners with Paul. So I see we now are out of time. And so I will simply say best wishes to everyone for a safe and happy holiday weekend. And with that, we stand adjourned. Thank you very much for your time and have a good day.